The current outbreak of Ebola that is sweeping across Africa is the largest in recorded history. The Ebola virus is one of the deadliest viruses on the planet because of its high 83% fatality rate and because there is no cure. In March 2014, the Ministry of Health in the West African country of Guinea reported an outbreak of hemorrhagic fever. A few weeks later, the World Health Organization had confirmed that an outbreak of Ebola had begun in Guinea. The virus has since spread into neighboring countries Liberia and Sierra Leone. We chatted to Dr. Augustine Gubba, a virologist at the University of KwaZulu-Natal.
Ebola is a viral disease. In fact, the term we should be using to describe it is Ebola hemorrhagic fever. It is caused by Ebola virus. Ebola virus belongs to a group of viruses called filoviruses. These viruses are characterized by filaments, as the name filovirus implies. The first outbreak of Ebola was reported in 1976. There was a simultaneous outbreak in the then Zaire and Sudan. And in Zaire, the outbreak was around the area through which the river Ebola flows through. And so this is where the name Ebola comes from.
The Ebola virus, like many other viruses, spreads throughout the body of its host by hijacking the cell's machinery. Dr. Edith Elliott, a medical microbiologist and biochemist, tells us more.
Now, primarily, this virus produces a secretory glycoprotein. So this is a protein that has a lot of sticky sugars on it, which confuse a lot of the signaling of the immune system. And this is the innate immune system. So these guys are the phagocytes, the ones that swallow up disease, and they're macrophages and neutrophils. And the neutrophils are the first cells that come in to look for infection. They're phagocytes, so they usually swallow up and then sanitize, remove, digest. Now, this disease is diabolical in this. They actually use these cells to get around the body. So they take over the neutrophil. And the neutrophil, of course, is a blood-borne cell that comes into the tissue, swallows up infection, and goes into, and then takes this away. It's removed into the bloodstream. So they hijack these cells, and then they go all over the body.
Once the virus has been established throughout the body, symptoms then start to appear. Initial symptoms appear flu-like, but that rapidly accelerates into a deadly hemorrhagic fever.
So you've got fever, you've got flu-like symptoms already starting with pain, joint pains, and inflammatory processes. So you feel you've got fatigue, you start to have, because now the virus has gone to the bronchi and to the lungs, you start coughing up blood because the vessels in the lungs are also becoming damaged because the endothelial cells are being attacked and becoming leaky, so they're leaking out red cells. And now you've got bleeding. You start coughing up blood, and the breathing becomes difficult. In the alimentary tract, you get bleeding, so you start to get diarrhea, you start to pass blood, so bleeding there. And also from the blood vessels, as more and more fluid leaks out of the blood vessels, you start to get what you call shock. Shock starts to set in, and what shock actually is a low volume, hypovolemia of blood. So there's too little blood flowing through your blood vessels. Usually then your brain starts to drain, and if you're standing up, you start to faint. But also your kidneys start to fail, your heart starts to fail. And finally, death is either through bleeding out or this hypovolemic shock.
Once an infected individual is symptomatic, then only can the virus spread from person to person. For the Ebola virus to spread, direct contact with body fluids are required.
Although it's an RNA virus and very similar in many ways to the flu virus, it's not spread by droplet infection. So in other words, the breath of one person sneezing and coughing, it has to be through body secretion. So you actually physically have to. So if you are able to keep your hands clean, if you're able to have sewerage removed and discarding waste safely. And you're just very careful with food preparation and monitoring, keeping people isolated until they have recovered totally.
The current outbreak has attracted the attention of world leaders as well as health organizations. Many countries are providing relief aid to affected regions.
This morning, I am declaring the current outbreak of Ebola virus disease a public health emergency of international concern.
With the World Health Organization declaring this outbreak an international emergency, and with many international airlines such as British Airways and Emirates suspending flights to the affected countries, this outbreak is far from over.
The best way to control or manage the disease is to avoid contact with people who are infected. So even if you look at hospital settings, the hospital staff, doctors and nurses have to cover themselves from head to toes, because the idea is never to get in touch with any body fluids. For people who are taking care of their sick loved ones, it is advisable also, if protective clothing is available, to put on protective clothing. And hygiene becomes also of critical importance, where you need to wash your hands, disinfect. And so this is the best way to manage the disease.
The Ebola virus is mainly harbored in fruit bats. These bats then have the potential to affect many other species, either through the fruit which they've infected or through human consumption.
There is only one identified carrier up to date, actually 3 species of fruit-eating bat. And the whole virus depends on infection through the body secretions, either of the carrier, which is the bat, that doesn't seem to show any effects whatsoever, or after the man comes into the picture and becomes infected, the body secretions of that person. Now, this is also complicated by the fact that some West African countries actually have bats as a delicacy, and they will eat the bats themselves, either smoked or actually in a spicy soup. So usually it's the contamination with the way in which the animal is handled and interaction with the body secretions with that person, and thereafter even through the eating of the meat that hasn't been properly sanitized.
There have been many outbreaks in the past, but none have come close to the magnitude of the current 2014 outbreak.
The extent of the current outbreak is unprecedented, given the number of countries that are now reporting the disease. And this can be due to a number of factors. I think if you look at the centers of origin of this current outbreak, there have recently been a lot of wars going on in that area. And as a result, the health services have broken down. And given that, I think these are the conditions under which the disease would thrive, because there's no running water for people to wash their hands, the hospital systems are not working, and I think this explains what we're currently witnessing.
The only way we're going to get over this is actually education. And this is really difficult, because in a culture that is used to taking care of their dead, embalming and washing and burying their dead in the correct way, it's very difficult for people in spacesuits to come in, grab their dead, take them off to a hospital, and they're never seen again if they die. So people have been hiding their ill people and trying to cope, and that is a big problem.
As of September 2014, the Ebola virus has spread into Liberia, Sierra Leone, Nigeria, the Congo, and Senegal. There are 4,300 confirmed cases of the disease, with the death toll currently at 2,300. Since there is no cure, experimental drugs are being tested on their efficiency on treating the virus. The World Health Organization has estimated that in the coming months, as many as 20,000 people may be infected with the Ebola virus. If strict measures aren't put in place, we could be looking at a catastrophic epidemic.